Yogarani, Chief Physiotherapist from ChanRe Rheumatology and Immunology Research Center from Bangalore. On the occasion of the World Arthritis, today I am going to talk about role of role of physiotherapy in arthritis. Before seeing the physiotherapy role in arthritis, first we'll see what is arthritis. Arthritis is a general term used to the conditions for affecting the joints and the tissue around the joints. The most common symptoms in arthritis like pain in and around the joints. Some of the arthritis like the rheumatoid arthritis, it will affect the immune system as well as affect some internal organs like lungs. Now we'll see the symptoms of arthritis. Each and every arthritis have the unique symptoms. So each and every patients also have the unique clinical features. We can't able to tell all the symptoms is universal for all the arthritis as well as the patients. Each and every arthritis and also the patients, the symptoms is very unique in nature. The common symptoms of the arthritis, it's a pain and stiffness. This is very commonly we can see in the arthritis patient. Then depending upon the arthritis, that flare-up, that sudden onset, sometimes the delay onset will happen. It's depend upon the type of the arthritis. The symptoms might be come and go, otherwise sometimes it persists for the long run. Now we'll see the causes. The most of the arthritis is the unknown causes. Some of the risk factors also is there. We can modify those risk factors like junk foods, then alcohol, smoke, then our sedentary lifestyle. So those are some of the risk factors to induce the arthritis like osteoarthritis, those kind of the things. So if we manage the healthy lifestyle, we are not that much prone to some kind of the arthritis. Now we'll see the role of physiotherapy. Before we are going to the role of physiotherapy, we'll see what are the principles we used to do before screening the patient, before taking the treatment for the physiotherapy. Some principles we have to follow before deliver the protocol to the patients. First, it is very mandatory one, establish the normal medical stages like anemia, osteoporosis, heart disease, atlantoaxial joint subluxation. Why we have to see all those things? These are the red flags. So we have to rule out before giving any mobilization, any vigorous exercises. Oh, these are the things we have to rule out the medical status before only. If the patient is osteoporosis, the patient have the knee stiffness, we have to go with the mild gentle mobilization. We can't able to do the vigorous mobilization to the patient. For that, before only we have to rule out whether the patient is suffered from osteoporosis or not. The one more about atlantoaxial subluxation, because it is very common in rheumatoid arthritis patient. In rheumatoid arthritis, all the synovial joints will get affected. In atlantoaxial joint also is the one of the synovial joint. So before giving, if the patient is coming with the neck pain, with the radiating to the bilateral upper limb. The physiotherapist planning to do the traction before we have to rule out what are the disease condition they have. If you are giving the arthritis patient traction, sometimes it happens the Atlanta axial joint subluxation. So before treating the patient, we have to rule out the medical status. Then second one, we have to see the blood parameters, that mainly the inflammatory parameters. All arthritis patient mostly, especially the inflammatory arthritis, the inflammatory blood parameters are in the higher level, like CRP, ESR. In these conditions, we need both the medical management as well as the physio management. When the ESR and CRP are elevated, it has to come down to the at least the minimum normal level. Then we have to start the physiotherapy program to them. So not fully we have to stop it. Then we can do the mild range of exercises, mild mobilization exercise to the patient. Then we have to confirm with the patient about ongoing medications, how they are taking the DMRDs, NSAIDs, and steroids. What are the ongoing medication status also? We have to take a history, whether they are taking regularly or regular medications. So those things we have to take a history before giving the treatment part. Identify the joints. It is very, very important before giving the physiotherapy protocol. We have to assess which type of joint has affected, how many number of joint affected, how much severity it is affected. These are the assessment is very needed before preparing the any protocol. So then we have to assess the patient passive range of motion, active range of motion, strength and function. Active range of motion is nothing but how much movement the patient can able to do. That we called the active range of motion. Actively the movement done by the patient. Passive range of motion is nothing but physical therapists, they assess the movement. It will be mild different comparatively the active range of to passive range of motion. So how about the strength of the muscle? How they are the ADL activities? So all the assessment we have to clearly take a assessment before giving the exercise protocol to the patient. These are the principles of physiotherapy. So what are the aim? So first, our main aim is to control the pain. This is the first, because all arthritis patients will have the pain. The second most common symptoms is the stiffness. So we have to minimize the symptoms, stiffness due to some mobilization, some manual technique we have to use and reduce the stiffness. And joint damage. Already arthritis patient have the joint damage. The further damage of the joints we have to preserve. So how we have to preserve with some assistive devices. Otherwise, some of the modification their lifestyle. Those are the plan we have to tell the patient. And physical active, that ADL activities. If the patient have the pain or stiffness in the shoulder joint, they can't able to comb the hair, they can't able to button their own dresses. So accordingly, we have to plan the protocol and we have to come out of them from the difficult ADL activities. And in inflammatory type of arthritis, we have to see the inflammatory parameters also come in the control level. So why exercise is needed? Because all the persons exercise is very, very needed. Why? Our healthy life and our fitness. Especially in the arthritis, exercise is playing a main role. Why we have to do the exercises? If we are doing the exercises, it will strengthen the muscle around the joint. It will free the all joints. The joint get moved very easily. Then we can increase the energy, the balance, the mood. So everything it will improve if you are doing the exercise on the regular basis. Why we need the strengthening program? It's really needed in the arthritis. Really that the bone wanted the strengthened muscle to support it. In arthritis, what happen? Due to the pain, the patient won't move the joint frequently. If you are not using the any part, automatically the muscle will go for the weakness. So the muscle can't able to give the support to the bone to bear the weight or do the any movements. So strengthening program is very, very needed in arthritis patient. So we have to plan the all the muscles have to strengthen. So these are the points we have to do. The exercise is very really needed in arthritis. Joint preservation. This is very important one because already due to arthritis, some of the damage will happen in the joints. Then we have to preserve the joint. Preservation is very, very important. How you are preserve the joints. First and foremost is the respect the pain. Is some of the patient what happened whether they have the more pain also, what we prescribe the same amount of the exercise they will do, sometimes it will flare up the pain. So don't do that one. Before starting the exercise, respect the pain first, because all arthritis patients will have the up and down. It's like a graph. One day the pain will be in the peak, then and the middle, then at least nil. So there will be like a graph of pain they can feel in their daily life. So before starting all your work, otherwise the exercise, you just respect the pain first. According the pain, you just plan the exercise. If really you are doing 10 count of the 5 times of exercise, today you have more pain on your shoulder joint, you can reduce the count, reduce the stiffness. Don't ignore the exercises. Do the exercises with the limitation of count. So before starting the exercise, think about your pain first. Then balance the activity, plan your day. So now you have you wanted to do the daily task. So don't rush and do all the tasks at a time. Just to plan your day, just to plan the work accordingly. You have to do some work, then take a rest, then go for the other work. So like that, plan the day and give the rest properly intermittent on your task and do the activities. It won't give much more strain on your joints. It will preserve the joint. It won't give much more stress. Avoid stillness. Why we are telling avoid stillness? Stillness is nothing but prolonged sitting from one, immove the joints. We have to move the joints repeatedly, especially in the arthritis. We have to move the joints. Then only the joint won't go for the stiffness. For that, if you are sitting for the half an hour, you just go for a walk of few steps, then again you come back to your position. If you are standing for the half an hour, you just sit and take a relax. Then you just start your next task. So those stillness you have to avoid in your daily life routine. So joint alignment. Joint alignment is very, very important. Not only in the arthritis, each and every human being's joint alignment is important. Because what happens if the patient, if the person is standing erect, so that distribution of the weight to the joint, it's equally distributed, it will go. Some persons have that slouch posture, otherwise the exaggerated back sway movement. Those and all what happen, some of the joint will get the more stress comparatively to the other side. So don't do that one. Make body alignment, that is nothing but our posture. We have to maintain the good posture. Then that equal distribution of the weight, it go to the joint, muscle, ligament, what are the structures are there around the joint, it will get the correct amount, quality of the stress, and it will go for the movement. If you are do the mall alignment, it will give the stress over the joint, it will damage our joints also. Then one more, maintain your body weight, because it's really we have to maintain the body weight in arthritis, because already our joint has damaged, already we are giving the stress to the joint. If the weight has increased, that the stress is more to our joint. So please make sure on your mind we have to maintain the weight. Okay, these are the things if I'll do, I'll get a good outcome of arthritis. What are the worsening things is happening in arthritis? There are the 5 things. It's really worsened arthritis. Nothing but not exercising, exercising too much, ignoring your weight, not using the mobility aids, not taking the medications regularly. Now we'll see briefly about not exercising. All the patients have, if I'll have the more pain, why I have to do the exercise? If I'll do the exercise, I'll get the more pain, why I have to do? It's really a right statement? No. If you are not moving the joints, what happens? Your joint will go for the stiffness. Your muscle will go for weakness. Instead of not moving, not doing the exercises, you just reduce the quantity of exercises, reduce the intensity of the exercises. Not doing exercise is really the harmful to your joints. So just to do the exercises, respect the pain according the intensity. You just to do. You can avoid the stiffness because all kind of the arthritis, stiffness is the major complications. If you are not moving, that swelling will happen. The joint it won't move freely on their full position. So it will go for the stiffness. So please do the exercises according to your pain. Just reduce the intensity. Don't avoid the exercises. If you have the more pain, otherwise you wanted to start the new exercises, just to consult the physical therapist first. They will give the protocol to you according your joint damage, according your severity of the disease. They will plan some protocol and they will give the exercise program. So before starting exercise, as well as you wanted to introduce the new exercise in your protocol, make sure just to consult the physical therapist first, then start doing the exercises. Why we are telling exercising too much also harm to the arthritis? Yeah, really. Because what happened today, I was good, okay. There is a no pain. Instead of doing the 10 count, if you are doing the 20 count, it also affects the joint. Don't give the more stress to your joint. So exercising too much also, it's not good for arthritis patient. Because a normal healthy patient, they can bear it because arthritis, already we have the damage, everything, we can't able to maintain. So too much of exercising also, just to think your mind. So what the plan, what the protocol that given by the physiotherapist, those protocol please follow to preserve your joint. Ignoring your weight. So if you are ignore the weight, the stress of the joint will be more. So already our joint has the pain. Again, we are giving the 10 more kg of the weight to the joint. It will increase the stress. It will increase the pain. So please make sure your weight also has to be controlled. So take the good dietitian opinion, take your diet control properly and do the exercises properly. Mind your weight. Don't put more weight, especially the arthritis patient. So not using mobility aids. Why we are telling? Because due to some pain and stiffness, the mobility of the patient's mobility will affect. If the patient have pain in the knee joint, they can't able to give the weight on the affected side. So that time what happened as a doctor and physical therapist, we will advise some of the stakes or otherwise walker, some of the assistive devices we used to tell. Don't ignore to use it. Why we are telling? Because on that time of situation, we have to give the rest to the joint. Rest in the sense, the stress. So if you are using the external assistance like a walker or sticks, it will give the extra support. It won't give stress more your joint. So if you have the pain more in your right knee joint, automatically you shift the all weight in your left knee joint. So what happened? Automatically, the left joint will get the more stress. It go for the more damage. So to avoid these situations, we are explaining the patient to use the assistive devices to give the extra protection. Then one more main reason, risk of fall. What happens if the patient is having pain in the ankle or knee? Automatically, the risk of the fall, because what happens, the patient can't able to give the good balance on their affected leg. So automatically, they will lose their balance. For those situation, we have to avoid. For that, we are telling the patient to use the assistive devices. So one more, some of the arthritis patient, they can affect the multiple joint, shoulder, knee, hip, ankle. In these situations, they can't able to move around. They'll be in the bed. Instead of sitting in a one place, taking help of the wheelchair, at least you can move around in your home. At least that moving facilities you can if you are using the assistance, at least the move around your home, you can get it. Instead of lying in the one place, you can move around with the help of the assistive devices. About the medications, it is really needed. You have to take your medications regularly because some kind of the arthritis are the chronic one. So the patients has to take the treatment for the long time of time. Your consultant as a doctor, they will explain about the medications, everything. So don't panic about the side effect, everything. If it's really anything happen, consult your doctor. Tell the symptoms. They will accordingly. Doctors can plan the medications. Doctors can help you out to control the disease also. So if avoiding the medications, it's worsen the conditions. So don't do that one. So continuing taking the medications also is a very important in arthritis. So my conclusion, so all the arthritis patients make sure to take the tablets regularly as per the doctor's advice and do the exercises regularly as per the physical therapist advice. If you have any flare-up of pain, anything, always consult the doctor and physical therapist to plan the exercises. Keep move your joint. Don't avoid the joint to move. It will worsen the condition. So take the medications regularly and do the exercises. You can come out of the. You can come out from the symptoms of like pain and stiffness. You can lead the better quality of life. Thank you.